Welcome to the Health Update. I'm Madison Kasper. Here with me is Dr. Aarti Raja, Mako Media's Science and Health Advisor. Welcome, Dr. Raja.
Thank you, Madison.
Our topic today is mosquito-borne diseases. So, Dr. Raja, we've been hearing a lot about mosquito-borne diseases. What are they?
Unfortunately, there are several types of mosquito-borne diseases. They're basically diseases that can be transmitted by a mosquito from one human being to another. And the several types of mosquito-borne diseases that are currently problematic include diseases like dengue, malaria, West Nile virus disease, triple E or equine encephalitis disease, chikungunya. So there are several of these diseases that are transmitted by mosquitoes.
What are the symptoms of these diseases?
Unfortunately, the symptoms of all these diseases are very similar. They tend to include fever, rash, and joint pain.
What are the treatments for these?
So this is where things become problematic. Again, unfortunately, there aren't any antivirals because these diseases are actually viral diseases that are moved around by mosquitoes, but there are no real antiviral medications that people can take. So the only treatment available is what we call palliative care, or just making sure you're okay and taking rest and drinking lots of fluids and keeping yourself indoors. So that's pretty much the only thing available right now.
How does this directly affect college students?
So it affects us at NSU because of just where we live. We live in South Florida. This is an area where these mosquitoes are abound. So naturally, these mosquitoes live here, they are around here, and therefore they are capable of perhaps carrying these viruses, and therefore they put all of us at risk in case we get bitten by these mosquitoes.
What is being done in South Florida to reduce the risks of people getting these mosquito-borne diseases?
Right. In fact, the Florida Department of Health does quite a lot in terms of mosquito management or mosquito-borne disease prevention. And one of the ways they do it is to prevent locations or areas where these mosquitoes may breed. And that involves ensuring that there is no standing water around public areas. And even if we do have water, and there's water around us, literally all around us, the water tends to, they tend to make sure that the water is moving. It isn't just standstill water. So they'll put pumps to make sure the water is getting pumped around. And we want to make sure that there are locations that don't have standing water. In addition to that, the Florida Department of Health also will do spraying events and activities to get rid of the mosquitoes.
Any last thoughts?
For us as students who are in college or people who live in South Florida in general, we have to just be vigilant about how we go about our day. Again, in our homes, around our homes, keep the area clean, ensure there's no stagnant water. And for ourselves, watch when we go out. I know it's difficult to put on long sleeve pants and long sleeve clothing when we're out so that we don't get bitten by mosquitoes, but that's one suggestion that's often given, is wear protective clothing in that sense so that you're not bitten by mosquitoes, or use some kind of mosquito repellent. And there are many out there that are very safe for use. So they advocate, the Department of Health advocates using mosquito protectants, and using that and keeping our environment relatively clean, we should be able to protect ourselves from these mosquitoes and hopefully thereby protect ourselves from getting these viruses into our system.
Thank you, Dr. Raja.
Thank you, Madison.
This has been the Mako Media Health Update. I'm Madison Kasper. See you next time.